we need expert also. So the question is why and how it's politically really important to implement prevention measures at local level. Okay, so why didn't we start with Michael? What do you think about it? Why and how is political will important to implement prevention measures at the local level?
I think we've seen lots of examples that in order to get large-scale change, we need to engage multiple sectors at multiple levels of government and across the community. And I think without political will, that's very unlikely to happen. People will focus on their narrow areas and things that are of interest to them. And so I think we have to incentivize these sort of multi-sectoral collaborations. And it is clearly a matter of both leadership from the top, but also grassroots efforts from the bottom, and they come together in a good way in a number of cases. And I think that's really is essential to do this kind of work.
Okay, you have realized that that is fundamental for all the actions. Yes, please.
Thank you. I mean, it's very difficult to communicate about healthier lifestyles to the population. So from the political point of view, we believe that if people feel that their leaders are committed to change habits, starting by ourselves, probably things will, in a way, start to work. But we do realize that it is absolutely vital, not only in terms of financing, but in terms of influence, to have a strong leadership in order to change habits and become a more healthy society, I should say.
Thank you.
Health systems around the world are characterized by almost infinite demand, but finite resources. So governments want to keep health off the political agenda if they possibly can by avoiding long waiting lists and all that sort of thing. And long-term programs like health promotion, disease prevention, even though they're hugely important, do require champions. And therefore, in my view, the political will is absolutely paramount.
I think that when the governments run in a political year, this has to be on the agenda. And the only way it gets on the agenda is by politicians are very simple animals in that sense. They poll, they see what the public wants. So the bottom-up approach needs to be there. There needs to be a champion that gets kind of the bottom mobilized. Secondly, I believe that if the politicians run with it and then plan their next 4 years and also do specific global planning for this, but also their specific planning in health with this in mind, with specifying what kind of budgets they're going to put, what kind of programs they're going to support, then the more specific they can get, the more chances you have that this actually happens. So the same as was said before, it needs to be a top-down and bottom-up approach, and the middle is usually the last to change and move. And then we see progress, and then we see a change in the whole population.
Thank you.
I want to echo what my colleagues have been saying, especially Michael. That's actually because the issue is so multi-sectorial and so multi-stakeholder real. Without political will, it's really very difficult to implement a successful program. We tried for a year until we decided to do this integrated national NCD prevention program. And it was precisely because it had to come a little bit the structure from top down. And secondly, what you were mentioning, the investment in public health is something that we reap the benefits of in the long run and in the short run. We have the pressures from hospital under budgeting, and that's something that politically one has to balance, and good communication strategies are actually really essential for that. Thanks.
Okay, thank you.
First, I want to say something that I forgot when I talked at the first, that we are trying to institutionalize our program. So because it's, like you say, a long-term challenge, and it's now becoming a public policy that is very important because it is associated with the sanitary or health objective goals of the decade. So, and from out of 50 of these goals, 16 has to do with this huge program. Now, if we don't have, I agree with all they have said, if we don't have the support of the president, the parliament, and of the politicals, it's impossible to arrive. And also, for instance, we are doing now regional seminaries and concourse that, and first exposing different experience at the municipal county, ¿cómo se dice? As a county, and also like civil experience, personal experience that have organized, and also different minister has many programs where people can apply it through internet for getting, for instance, now we are doing with 100 squares with machines and with monitors and people for doing it exercise at their neighborhood. We have programs also at school to apply for doing healthy kiosk. And like that, many public offered from different ministers for people from the bottom, from local people, or also different services, public service, may offer or concourse to do these activities. Thank you.